Hello, everyone. I'm Dr. Debbie Hamilton. Today, I'm going to talk about addressing stress, anxiety, and burnout in practitioners. I don't think anyone listening, anyone in the world at this point, um, especially in healthcare, hasn't related to some of these feelings, essentially. And then trying to find healthy ways to treat. Um, and also kind of really understanding the issue and kind of what the world is looking at, what the medical care is looking at, what we can do ourselves. So, a very relevant topic, really kind of where we are right now. So, I was happy to see this, that they're really starting to look at this. So, this is a July 2022 survey of America's physicians. And they really wanted to see the state of physicians. And I actually looked at nurses also, which I think that they're in a bigger crisis than the physicians are. But I like this. 6 in 10 physicians have felt inappropriate feelings of anger, tearfulness, anxiety. 1/3 have felt hopeless. Half report withdrawing, right? So those are not good statistics. Overall well-being has affected them and their colleagues while on the job. So burnout rate 60% in 2022 compared to 40% burnout rate in 2018. So that's a significant jump. So one of the other things that happens with physicians, and I was trained kind of this, that you can't show weakness. If you kind of try to reach out in your medical field, you actually have to put it on medical license and stuff. So people are afraid of kind of reaching out and kind of identifying that they have issues. So I think that is a significant issue, even starting in residency. I was sick one day in residency and I was on a surgery rotation. And I came back the next day, it's like, oh, what hospital were you in? That if I was sick, I actually had to be in the hospital enough to actually have a day. I was like, oh, okay, there we go. That's the attitude that we lived in. So proportions of physicians who often had feelings of burnout, 2022. Employed physicians, much higher. You think about it working in a hospital structure. I think also just dealing with the more COVID patients, I don't know how you would not be burnt out. Higher rates in female physicians, 68% versus 58% in men. Male physicians, still both of them are very elevated, right? More than half. So when I think about burnout, I usually think about burnout, one kind of adrenal burnout, but having overlapped depression, anxiety, but never really looked at how to quantify it, which I think is important. If we need to know how severe this problem is and how we're going to address it, we kind of need to know how bad it is. And so this is a burnout inventory. 3 areas: emotional exhaustion, personal accomplishment, and depersonalization, and then never to always, right? So I thought this was really interesting. Now, as I said, that triad, and then at least trying to kind of quantify where we are. And I thought this was interesting too, interpretation of burnout. So basically you're burnt out, you have high emotional exhaustion. Well, that makes sense. High depersonalization. You're really kind of disconnected from people, withdrawn, to me, very much like a depression issues. And personal accomplishment, very low. So you really don't feel good about what you're doing, right? It doesn't mean anything. And I think I've been in burnout from full-time practice. And I think I don't know if I've known many physicians who haven't had some point in their career where they really felt some of these feelings. So ideal is engaged, low emotional exhaustion, low depersonalization, high feeling of personal accomplishment. And then I said there's combinations of all those in between. So I'm just going to make sure I keep my time going here. So causes, and I don't think any of these are going to be too surprising. Too many bureaucratic tests. And I think a lot of these are relevant to physicians who, and I'm going to say physicians, but also practitioners. I mean, I don't think it's just an MD, DO, chiropractors. I think anybody who works in healthcare. And I said, I'll talk about nurses also, but too many hours at work, all those electronic records, I think that's added so much time. Feeling like just a cog in the wheel, all the continuing education, too many difficult patients, too many patients in a day. And here we are talking about integrative care, where the longer you're in it, the more complicated your patients are. I mean, I see complicated kids, and then now I see complicated parents, essentially. And then, of course, obviously who you work with matters also. So in terms of being a woman, a female physician, outside work stressors, the statistics show that women physicians spend an additional 8.5 hours per week on domestic chores. And I think domestic chores, also childcare, than their male counterparts. And I said this in a group of women physicians, they're like 8 hours? Huh, right. Like, it's definitely more than that. But I said childcare, domestic chores, lack of support. How about relationship stress? Lack of time, competing responsibilities with work and kids, time for self-care, right? Aren't we supposed to tell our patients? And one of the big things, integrated medicine, you got to take care of yourself, you got to sleep, you have to have exercise, healthy diet, rest, right? And relaxation. And then we don't do the same things. So I looked at nurse burnout rates. I think about all the nurses in the hospital during COVID, and just the intensity of that. Like, anybody who worked in the hospital during this whole past couple of years. And I looked at a lot of different surveys for nurse burnout rates. And this one shows out kind of roughly 30-something% depression and both. But I saw surveys as high as 80%. So it seems like a range 30 to 80%. And I said it wasn't good going into COVID either. And this is leading to a severe nursing shortage. There's estimated over 1 million open positions. So I think in terms of people burning out, a lot of people in nursing quit. I think a lot of practitioners are also leaving too. So what about just general depression and anxiety? And I really think of them together. I would say most of the patients I have an overlying, depression with stress kind of equals anxiety. And this is kind of, I wanted to look pre and post-COVID. And so pre-COVID, and the younger you are, the more rates are. And so kind of, I treat it really up into young adulthood, you're roughly 20%. And then as you kind of go along in age, it tends to decrease. And then if you look at kind of post-COVID, then everything doubled. Like, if you look at all of these rates, at least of them doubled. And that's what I was seeing. I would see, especially teenagers, just new onset anorexia and just not functioning. And even like 8-year-olds who they can't go back to school. And then some kids have been home and they learned how to wear a mask, and then they're afraid not to wear a mask, they feel uncomfortable with it. So a lot of complex mental health issues. I'm giving you all the scary statistics first, and then I'll give you some optimism about how to help. But this is some of the things that surprised me. So physician suicide, they have the highest suicide rate of any profession, about 1 a day. It's about twice that the general population. And many of them have untreated depression, not a mental illness. And here they say depression, estimate 12% of men and 20% of female doctors, female practitioners. I would say it's much higher than that. Again, for people in healthcare who are helping people, to admit that they actually are struggling is also a big deal. The other thing that's actually kind of frightening, but if you thought about it, it's not that surprising, is that physicians have a far higher suicide completion rate than the general public, which is probably why the rate's so high. So think about it, they would know what medications to take, how to be more successful, right, in terms of anatomy and everything else. So that's frightening in its own right. So symptoms of anxiety, I think of like anxiety and depression, especially in kids, as you got your physical symptoms and you've got like kind of the mental, emotional ones. So physical, just think of anybody who is in fight or flight, right? Panic mode. Your chest is tight, you can't breathe, your heart's racing, it's hard to sleep, it's hard to calm down, you're sweating, you're shaky, you're tense, your stomach feels sick. As I said, anybody can I think anybody can relate to that. Psychological anxiety, it's kind of a sense of impending doom. I'm worried about this, I'm worried about this. Is this gonna happen? Is that gonna happen? And I think of anxiety as kind of a stress response also. And then people, when they're anxious, can withdraw, right? I gotta withdraw, I can't take this, I gotta try to protect myself. So children with anxiety, depending on the child, I think people are more aware now, but a lot of children don't go to mom like, well, I'm really anxious, I'm depressed, mom. It's like, no, they're really clingy, don't leave me. A lot of what I have is kids with pretty bad behavioral issues. School's not going well, they're crying, they're fighting, they just, they're not eating, they can't sleep, they're crying. But a lot of parents will come like, oh, he's just acting out, he's really having a tough time in school, is this ADHD, what we need to do? And you kind of start getting underneath depression, anxiety. I think we really need to make sure we recognize what's going on in these kids, because the longer it goes on, the harder it is to treat. So if you can treat the children, you hope, and I said, not growing up with depression, anxiety. And then symptoms of depression, again, you got your physical symptoms. And I think of anxiety as kind of like an overactivity, and kind of traditional depression was more under, kind of a low energy, tired. Again, so people come in the practice, I'm like, I'm just so tired. I'm just so tired. I don't have any motivation. I can't concentrate. Is it kind of like a really fatigue issue, or is it a mood issue contributing that? And then obviously sadness, but anxiety plays a role in it. There's a lot of irritability, which you wouldn't think of in terms of depression. That quick, poor stress response is how I think about it, getting upset very quickly. So what I think about, and what I really want to concentrate on in terms of treatment, but also is thinking about depression and anxiety as symptoms as opposed to diagnosis. So if somebody comes in, with depression, anxiety, and that's what you're coming down to, it's like, well, why? And usually there's several different factors and multiple different factors, but kind of teasing them out and treating them can make a big difference in terms of long-term health. So neurologic, traumatic brain injury is a big one. There's a high percentage of depression, anxiety, kind of post-traumatic brain injury. The worse the brain injury, the worse the long-term complications like that. Obviously, some of the psychiatric issues, seasonal depression going in the winter here. A lot of our hormone issues, our endocrinology issues. Thyroid is a huge one. In terms of low thyroid, classically more depression, hyperthyroid, more anxiety. A lot of our different medicines themselves can cause problems with mood, infections, anemia, different blood issues, nutritional deficiencies, which I think, and that's a big way to help treatment too. So risk factors. I think stress, we talked about stress. It can be social stress, lack of support, family, kids, relationships, burnout, like work stress. You can't overlook trauma. And trauma, a lot of people, when they think trauma or PTSD, they think, oh, well, I wasn't in war, I'm not a vet, how can I have PTSD? But even people who develop depression as adults, you can go back and it can be from early trauma. Sexual trauma, physical, verbal, divorce trauma, death, loss of a loved one, harassment at work can all cause different traumas. There's a genetic component. So there are different genetic SNPs, which we'll talk a little bit about, that contribute to depression. There's also increased rates in family members, which is, again, probably multifactorial. They eat the same diet, they're in similar environments, similar genetics. But if a person has a parent or a child or a sibling with depression, they're at much higher risk. Chronic health issues. A lot of people with chronic health issues have mood issues, and that plays a role from inflammation. The inflammation itself, the cytokines in the brain and neuroinflammation contributes to depression and anxiety. Mitochondrial dysfunction. Think of those mitochondria, that energy in the cell. Poor diet. I don't think we have to convince anybody here that, well, diet plays a role with mood. Excessive caffeine, I think, is an issue with anxiety. And again, genetically, some people are much more intolerant than others. Any kind of drug abuse, smoking, alcohol, decreased physical activity. Exercise is one of the best things we can do in terms of treating depression, anxiety. Decreased personal time, no downtime, essentially. Poor sleep. Sleep is a huge issue. And I'm going to be talking about that next month, because that plays a huge role in mental health. COVID pandemic, talk about stress. And then again, female higher than male rates. And that is across the board for all mental health issues. And the part of that, maybe I you always have to wonder if then women are more likely to kind of admit and reach out than men. So, and I think men in depression sometimes it's more of an irritability than kind of a kind of a low mood. And I think they kind of, I said, seek help less than others. And that's definitely true of male physicians versus female physicians. So I think about treatment kind of an integrative and comprehensive approach. I really think you have to approach it in that way. And that's really the most successful that I've seen this. So social environment, workplace support, family support, support for, parents, especially parents with special needs kids. They need a lot of emotional support. There's a lot of mood and burnout issues, and caregivers, any kind of caregiver. Prescription medicines do play a role. The sicker patients you see, the more likely they need medicines. And that can be, I try to think about it what can we do kind of from nutritional and kind of a functional medicine perspective, but sometimes that takes time to figure out and implement. So maybe some people need medicines just to get to the point where everything else is kind of cared for. And then, as I said, I as integrative functional, I use all the tools I have. Therapy is another tool. Cognitive behavioral therapy, kind of talking therapy, play therapy in kids. EMDR, I think, is so helpful for trauma. And that's eye movement desensitization therapy. It's essentially taking that like PTSD, that body memory that you get triggered and get upset, and kind of basically disconnecting that. So it could be very helpful. Physical health, diet. I don't think I have to tell anyone in this group how important diet is. Sleep, huge. Exercise, huge. I'm going to talk a lot about different supplements and herbs, things that can be helpful. Self-care, I think, is important. And then our evaluation for chronic disease and other diseases, from thyroid to infections. And I said I'm going to talk more about that. So in terms of getting social support, I think one of the most important things is having this issue in the healthcare workplace acknowledged. So I was really happy to see the National Academy of Medicine in 2022, so this is really recent, set up 7 priority areas in order to address this issue. And these priority areas are really well thought of, create sustained positive work environments, actually try to get some measurements. How do we evaluate this issue? Support the mental health, reduce the stigma of getting help. I guess, engaging technology to do this. And again, great first step. And then implementation is key. But this is kind of more of the social environment, especially for the workplace part in terms of burnout. So when I think about laboratory testing, again, here we're going into our integrative functional medicine, nutritional. So looking at, there's a lot of blood labs you can do, from vitamin B12 levels, D, zinc, looking at your iron, thyroid panel, as I said, low thyroid being involved with depression. There's studies that look at just supporting T3 as improving depression symptoms. The organic acid test is one of my, if you've ever heard me speak, I always speak about this because it gives so much information. You can get neurotransmitter metabolites, which really gives you an idea of things like the COMT. Do you have a genetic SNP where somebody is breaking down dopamine too much, or they don't have enough dopamine? And that can influence, your mood and behavior. The MTHFR people know about. Think about the B vitamins, the special folate, the B12, how that can influence everything from detoxification to forming neurotransmitters. You really got to think about all this, all the dysbiosis markers, right? Overgrowth of candida, mitochondrial markers. I think that's one of the most helpful ways to see mitochondrial dysfunction. It also gives some nutrients, B6, B12, folate. So really, really helpful. Also detoxification markers. Adrenal stress panel. So I think of burnout as people have really low adrenals. But there's a lot of different ways that people have in terms of adrenals. So the adrenal stress panel is 4 saliva cortisol measures. In theory, you're supposed to be high in the morning and then kind of slowly go until you're low at night. And so some people kind of depression and kind of burnout, they wake up, they can't get up in the morning, they're just exhausted. And they really never get that energy. And then some people with anxiety will have cortisol go up at night. And it's really hard to fall asleep if your cortisol is elevated, right? So it can be completely switched or can go up and down. And it's good to, in terms of treatment for mood and anxiety, to really kind of figure out that pattern. I think a digestive stool analysis is important, really further evaluating that gut-brain connection. Is there inflammation? What kind of bacteria and yeast are you talking about? Food allergies and sensitivities. It's amazing how much gluten and dairy can make in terms of behavior of people, especially in my kids with autism. So sometimes eliminating certain foods can be a huge boost in mood. And you're also decreasing inflammation and the immune system. Genetic SNP evaluations. There's several. There's a company called Intellex DNA that has very extensive panels and some very targeted for different conditions. Genomind looks at the genetics in terms of different medicines, but it also, because of some of those genetic mechanisms, it also helps you figure out some of the supporting things. Chronic disease evaluation, depending on history. Is this a person not only with mood issues, but fatigue and pains and rashes? Do you need to look at Lyme and Borrelia? EBV is classic. What about autoimmune disease? Neurodegenerative disease, dementia. Sometimes people present with, kind of lowering mood issues and cognitive issues. Hormone evaluation, depending on history and age, right? That can influence, a 13-year-old girl with a lot of mood issues. They really can look at hormones, obviously. So now I'm going to go into some treatments. And again, I always start with diet. So we're already assuming you know about a good diet, whole foods, organic, fruits and vegetables, good protein, good fats, right? Avoiding artificial sweeteners and dyes and preservatives. And then I think about some targeted nutritional supplements. Again, you're looking at evaluation, but so magnesium. Magnesium is one of the low minerals in diets now. It calms neurotransmission, so it actually regulates glutamate GABA. It really helps the HPA axis, right? So it's helping modulate the stress response. It supports synthesis of serotonin and dopamine, increases BDNF, our neurotrophic growth factors in the brain. And I also think of magnesium as it's great for sensory issues, right? It's also very calming in a lot of different ways, but it's great for muscle aches, headaches, constipation, and it's helpful for sleep. So really, overall, a great mineral especially for anxiety. So zinc. I was taught a long time ago, integrative medicine, no zinc, no think. And I like to say that to patients and their parents, because it's very much involved with mood and cognitive processing. So the classic zinc deficiency, you'll see somebody, what I call rage behavior. So they go from 0 to 60 like that. And I'll have parents come in with that. They have a behavior problem, they get upset really quickly, go like that. It's like, okay, we got to look at zinc. Sometimes they have white spots on their nails. That's a really good sign of zinc deficiency, pretty more severe. And again, zinc is important for immune system and inflammation. You take the inflammation down, you're helping with mood also, right? So some other things. For wound healing. Vitamin B6. Vitamin B6, I like the active form of B6, the P5P, which is the precursor form. That one, I feel like every once in a while, people are like, oh, I don't do well with B6. You do have to, especially with the classic B6, you have to be more careful with doses. But P5P is much safer, and I haven't seen that kind of overactivity you can see with B6. It's very helpful for depression, anxiety. People use it for in pregnancy for nausea and morning sickness. Very helpful for hormonal swings like PMS. So, and I also think B6 is also important in building serotonin, right? It's one of the precursors. So that's very helpful also. I'm thinking of our calming neurotransmitter. Omega-3s, fatty acids. I'm a big fan of cod liver oil because you get vitamin A and D in there. But omega-3s, it's an anti-inflammatory. So inflammation helping the mood. It helps with the not activating the HPA axis from the inflammation or lower neurotransmitters, antiarrhythmic. It's a really good mood stabilizer. And there's studies that look at omega-3s and the doses usually more up to 2 grams as really, really even helping bipolar, right? Really helping stabilize that mood. And with our classic diet, people are low in omega-3s. So I don't even measure them in the majority of patients because I know they're low. It can make a big difference in ADHD. And I said bipolar, children with autism, even improving speech. Vitamin D, another one that I think is kind of just a basic, but a role in mood issues. And especially think about the winter. Here we are, we have less light. We're about to have even more less light and, less vitamin D and more kind of seasonal affective disorder. Again, anti-inflammatory, good for mood, good for immune system. So many different things that the vitamin D. And I do dose really depending on blood levels, with the idea of ranging 50 to 80. Psychobiotics, we get our new probiotics. Now we can rename them psychobiotics. Really learning, and there are more and more information and more strains and more studies, which is great, looking at microbiome on mood. Some of the things, you kind of go back to the basics, which is why looking at the gut is so important. But think about the vagal nerve, think about the systemic circulation. You have candida or mold or bacteria, they release those toxins. The toxins trigger the immune system. They get to the brain. We got more serotonin in our gut than we do in our brain. So you can it really starts to make sense when you think about it, how this is kind of connected. So then if I go to general nutrition support, I often think of just kind of a daily vitamin. We have a physician's daily that has 25 milligrams of zinc, which I think is a great dose. Methyl B12, methylfolates, and activated Bs, core minerals. And again, additional testing showing me additional vitamins and minerals. Omega-3s anywhere from 1,200 to 2,000 milligrams, supporting the gut microbiome, like a multibiome, P5P, magnesium. I like magnesium given at night in terms of sleep, and then vitamin D. So I'm going to go into a product I helped develop called Anxiety Ease, really to address anxiety. And there's a lot of calming things here, so it's helpful for anxiety and depression. And I'll show you the chart in a little bit. But what I do when I develop a product is I look at research at all the individual ingredients. And then we think of, well, what kind of mechanisms of action do we want? Like, what are contributing to anxiety that we can modify and support with the ingredients? So you see the B6 as a P5P form and the magnesium. So a lot of this, and this even goes into sleep, is really trying to support and increase GABA. We know GABA is our primary inhibitory neurotransmitter in the brain, right? So it's going to decrease that excitatory neurotoxicity from like glutamate. It's common. It says calming. And to think about like the way that, our prescription anti-anxiety medicines like the benzodiazepines, how they work is they increase GABA, right? So thinking about it, how can we do it naturally without creating addiction, right? And severe withdrawal and severe issues. So in terms of ingredients, so the herbs, I thought about the herbs in terms of, well, I wanted adaptogen herbs. And adaptogen for me is kind of getting to homeostasis, right? Your cortisol, you're too stressed, you're anxious. Let's bring that down. You're kind of burnt out, fatigue, let's bring that up, right? kind of let's modulate the HPA axis, really important. So holy basil is an adaptogen. So we want ones that decrease stress and anxiety. And if you look at each one of these is research that shows it lowers cortisol, research that shows it decreases stress. So as we go through these individual ingredients, that's what that means. In terms of all these different herbs, they're all anti-inflammatory, antioxidant, right? Knowing that decreases inflammation itself, just by that, you help with mood issues. And then ashwagandha. I said, I think ashwagandha is one of my favorite herbs. I think people are very familiar with ashwagandha. So it's an adaptogen, which is one of the really important things. So we know it lowers cortisol and that stress response. It also increases BDNF, the brain-derived neurotrophic factor. So it's important for neurogenesis and neuroplasticity. And that itself just supports mood, improved mood, health for sleep, mood issues, GABA modulation. Phosphatidylserine, one of our phospholipids, a lot of great research in terms of lowering stress and cortisol, helping with memory, helping with acetylcholine, improving those cell membranes, so helping with the mitochondria, dysfunction too. Lemon balm, another one that I love. Official name is Melissa officinalis. Great for stress, anxiety, calming, anti-inflammatory, GABA modulation. And I learned about lemon balm when I studied essential oils. So the essential oil Melissa has studies with it for panic. So people who are kind of like panic attacks can even smell and use that in a different way, and actually with a good calming, pretty quick response. So that's how the lemon balm came in here. Lavender, I think we're all very familiar with lavender. Great research on lavender in terms of calming. There's a reason we know about lavender. Also helps with pain, in addition to calming. Passion flower, stress and anxiety and GABA modulation. And when I looked at different herbs, I'm looking always for synergy. Herbs work better together. And with GABA modulation, there's different GABA receptors. So I also tried to take that into account. So we wanted to make sure that we can cover some of these different ones. And then addressing the gut-brain microbiome. So Cerebiome is a patented probiotic that is 2 different strains, very specific strains that has research on it improving depression. And again, using the idea of improving the gut-brain axis. In this study, in 8 weeks, they looked at a placebo versus a prebiotic versus Cerebiome. And Cerebiome had significant decrease in depression versus just a placebo or a prebiotic. And this is some more references about the multiple different studies. So felt that this is a great addition to really cover different mechanisms. And this is my spreadsheet. As I said, I take the different ingredients. Each of these X's is research. Obviously, things that are studied more, there's a lot more information. And sometimes there's no X's because there's not research on it. It doesn't mean that it doesn't work. But really kind of these are the things we were thinking about in terms of developing this. So kind of mechanism action summary, modulate the cortisol response, especially adaptogens, decrease mood issues, and really looking at GABA modulation, but also serotonin, anti-inflammatory, and then supporting the gut-brain axis. So I'm just going to go into some other things that are helpful in terms of, again, doing the differential diagnosis of depression and anxiety. So a lot of people who have mood issues also have cognitive issues. It's like, I'm depressed, I can't concentrate, I can't pay attention. I think they all go very much together. So BDNF Essentials is a product we have that's neuroplasticity support. So it's designed to increase brain-derived neurotrophic factor. We have research that we just submitted for a publication that showed improved mood and cognitive processing, along with decreasing cortisol levels and decreasing inflammation. And then we have cognitive support, Cognicare, which I think of as kind of a increasing blood flow, kind of an anti-aging cognitive support. And some people use these together. In kids, I use the BDNF Essentials. I do not use kind of something that's more targeted towards adults. 5-hydroxytryptophan is one of the precursors of serotonin. And so serotonin is a precursor of melatonin. So helpful for sleep, but help for mood and anxiety. And again, 5-hydroxytryptophan is an amino acid. So L-theanine, I use this a lot. It's an amino acid. It's a component of tea, shown to improve sleep, decrease anxiety. It's helpful for attention. It's helping GABA and serotonin. I like this, increasing calming alpha waves in the brain. The way I think about L-theanine is like, somebody's like, I'm here, I'm scattered, I'm thinking here, I'm kind of anxious, and kind of, let's bring it all in, right? Kind of calming, you can focus better. Use this a lot with people with ADHD. Sometimes people do have an opposite reaction. I think especially in kids with autism who react a lot to different and opposite reactions, but that's just something to keep in mind. So other things that increase neuroplasticity, increase BDNF, which is associated with less depression when it's higher. Physical exercise. As I said, exercise helping depression, anxiety, learning new skills, basically using your brain, using your body, sleep coming back as something healthy. And then some of the herbal supplements that we talked about. And then always good nutrition, getting fats into that brain. So some of the worst things for our brain and our mood are stress, like increased cortisol contributes greatly to burnout, to depression, anxiety, really that combination of all of those. Right, if you're not active, that plays a big role also. So disease states associated with low BDNF, depression, mood disorders. Traumatic brain injury is really interesting. Even early on, within like a day or two of traumatic brain injury, the BDNF goes down. And the lower the BDNF from the brain injury, the worst outcome in terms of cognitive, mood, and anxiety symptoms, even like 6 months plus. Autism spectrum disorders, ADHD, degenerative disease, and again, all those mood disorders. And here's looking at depression and inflammation and BDNF. So the more inflammation, the lower the BDNF, the increase in depression. So again, how we target inflammation along when we think about depression and anxiety, right? So think about it as a symptom and addressing the symptoms and addressing all the different causes of the symptoms. And the interesting thing, so another one of the genetic SNPs, there's a SNP in BDNF. The SNP is in the Val-Met polymorphism, and roughly 20 to 30% of Caucasians actually have that SNP. So those people are in increased rates of depression, anxiety, mood, bipolar, and that's probably part of the familial. I don't know, I haven't seen studies in other ethnic groups, but my guess, as I said, there are different ethnic groups that have different, certain ethnic groups have increases in MTHFR. So it's kind of, I think that all plays in genetics. But I think if you add enough stress and some of the other things to anyone, because it's a whole different picture. So this goes into the SNPs. This is a chart that I learned some of the genetic SNPs. This is Amy Yasko, who kind of came before 23andMe, kind of before the big, she was the one who first introduced some of this. So every colored box is a genetic SNP. And a SNP stands for a single nucleotide polymorphism. Basically, these are enzymes. And then you have a genetic difference or something in the enzyme, which means it makes the enzyme work better. But sometimes if it's too fast, it breaks things down too quickly, or worse, where it doesn't be able to make things. So if you see something like this, the COMT is a big one. Here's our serotonin. Here's our dopamine. And here you have to break it down to norepinephrine. And depending on these, this can make a difference in terms of where your neurotransmitters are. But look how all these circles are all related. So if you can have a genetic SNP and MTHFR, this can lead to neurotransmitters. Here's our vitamin D receptor. wow, that plays a role in methylation. That plays a role in our neurotransmitters. And here goes into detoxification and formation of DNA. So you can see how this all relates. Here goes detoxification. Here goes to cortisol, right? So we're all interrelated, but this is a way that can be really helpful. And each enzyme has different cofactors. So different cofactors are a lot of our vitamins and minerals. So if you're low in one of these, that's going to influence the enzyme and that metabolism also. So then fatigue. As I think fatigue is very common with depression and anxiety. I think they all go together. So sometimes you can look at what are the causes of fatigue. Well, we can look at the mitochondria. And I mentioned looking at organic acid metabolites for looking at mitochondrial metabolites. And we have a product called ATP 360, which really helps the mitochondria. And we have research on that shows improvement in fatigue. CoQ10 Power is a really high dose of CoQ10, and I think that's really helpful. And some people really need that, and you can tell that from the O test. Adrenal support, right? Thinking about adrenal burnout. We have energy multiplex. And sometimes there's other factors, other things that are helpful, like licorice. And this just kind of says that certain countries, I think New Zealand specifically, they are not able to get that product because of one of the ingredients. So mitochondrial support. So symptoms of mitochondrial dysfunction can be very much like depression, chronic fatigue, poor exercise recovery, low muscle tone, poor endurance, that brain fog, cognitive issues, and depression. And then a lot of factors that can contribute to depression and mood, like chronic disease, medicine, nutrition, inflammation, can all contribute to mitochondrial dysfunction. So you can see how all these things start to interrelate and contribute to mood issues. And this just shows, this is a kind of a summary from an organic acid test, really showing, different markers. So everything in a box here, is a nutrient that you might need. And the things in purple are the metabolites that you measure. So here carnitine, that you can tell if you need more carnitine, and carnitine is really important to get the fat, fat soluble molecules, get those fat metabolites into the Krebs cycle. So here's ATP 360. And just a quick summary of published research in terms of, in 2 months, 52% reduction in fatigue, improvement in sleep, improvement in mental functioning. And mental functioning comprising like a big questionnaire, but cognitive issues and a lot of mood issues, right? So I think that that's saying that this versus mitochondrial dysfunction, that's depression and mood are kind of a facet from that. Adrenal fatigue. Again, I think of adrenal fatigue as burnout, but it's also, so you see a lot of depression. That's that fatigue, depending on when your cortisol is high or low, you can have fatigue at different times of the day, or you can be completely burnt out. And this is kind of fatigue that it doesn't matter if you sleep all night, you're still tired. People who get up really quickly and get lightheaded, low blood pressure, low blood sugar, weak, problem with digestion, poor immune function, poor stress response. I think that's one thing you see in burnout a lot, is that poor stress response. So instead of being able to kind of go with things and everything else, the little things, it's too much, right? It's too much when you're burnt out. So here's the energy multiplex. And as I said, these are some of the key ingredients and things that, and this also has some good mitochondrial support too, along with adrenal support. So think of adrenal support as like adaptogens, like we talked about in terms of cortisol, different nutrients, sugar D-ribose that kind of help with ATP, taurine, really good kind of cardiac and skeletal muscle, different components from the Krebs cycle, rhodiola and ginseng are the adaptogens. So this one actually does, it's, energy, as it says, it helps with energy. So this is definitely for people who are kind of low energy, give it in the morning to try to get that energy. And there are multiple pages of basically references, a lot which I use to kind of develop products. So that's for people. So I am open for questions at this point, but I do want to thank everybody for taking the time. Anybody who's here, I'm sure, is concerned about themselves, concerned about loved ones, concerned about patients, probably all of the above, in terms of some of the mood issues and some of the things that people are dealing with now. So any tool we have is critically important, really looking at it from so many different angles, because I think it takes a combination of things to really help ourselves and help other people. So hopefully this gives you some good tools. And I very much, as I said, appreciate this. I will look into the chat for questions. All right. So I said, please feel free to post anything in terms of any questions. If you think of something after this, feel free to email me. It's dhamilton@researchednutritionals.com. Thank you very much. I'm just going to stay another minute or two if anybody has questions. Otherwise, as I said, if you email me, if you think of something else. But thank you very much, everyone.